Yes, ma'am.
Okay, good morning, student, once again. So let us continue on whatever the remaining portions of it. Okay, so the what was the last topic that I have taught you all? Manas. What was the last topic that I have taught you all? Manas. Okay, Jiban, what was the last class I have taught you all?
Poisoning by skin absorption.
Okay, thank God my network is good. I thought that. Okay, Manas, what happened to you? You are acting or something is wrong? You can share in the chat box. Okay, can you see the screen, student?
Yes.
Yes, ma'am.
Okay. Okay, I think we have completed this. So we will now I'll be giving you all the sign and symptoms. Okay, we will be discussing about the sign and symptoms. So we were discussing about the like this poisoning by skin absorption, poisoning by injection, poisoning by okay. Okay, you can write down the heading. Okay, you can write down the heading as sign and symptoms of poisoning. You can write down like that. और जनरल साइन एंड सिम्टम्स ऑफ पॉइजनिंग जैसे सिलेबस में वैसे भी हेडिंग लिख सकते हैं just write down the point sign and symptoms. Okay, I would like to ask you all the questions that if someone is in the conditions of poisoning. Okay, so what are the sign and symptoms that you can observe?
Ma'am,
Bolo.
Ma'am, bubbles can come out from the mouth.
Okay, very good. Okay, that is foamy. Okay, we call it foamy. Some. Okay. Okay, what about others? अरे इतना सारा वो है ना. I already...
Unable to breathe.
Okay, very good. Okay, then if you understand my explanation, you will be able to say so many points.
It will unconscious.
Skin color.
Skin color. Okay, very good. Skin color. Who mentioned that?
Vomiting, ma'am.
Yes, vomiting. Okay,
It will unconscious, ma'am.
Unconscious.
Yes.
Okay, Balo, very good. Okay. What about others? Anything else? Anything else?
Confused mental status, ma'am.
Very good. Okay. And what about others? Any other point?
Shortness, ma'am.
Okay, very good. Any else? Anything else? That means you all have understood my explanation. Okay, let us come to the main point. First is the nausea and vomiting. No? Okay. First point is the nausea and vomiting. And the other one is pain in the lips, mouth or throat. मैंने थोड़ा देर पहले explain किया था ना? What was that? ये क्या poisoning का अंदर में आता था? Pain in the lips, mouth or throat. जल्दी बोलो.
Swallowing.
Okay, there will be swallowing, pain in the lips. If you swallow some like some toxic substances, so there will be pain in your lips, mouth, throat, all those things, esophagus, etc. All those things. So ये सब में pain होगा. Okay, pain. This is the another symptoms. Okay, next is frothing from mouth. Do you know what is frothing? Frothing from mouth. This is very common symptom.
Yes, ma'am.
Any idea?
Foam, ma'am. Foamy.
Yes.
Bubbles like.
Yes, bubbles like जो Kostov ने बताया था ना, bubbles. There is foam or like it is like bubbles, the small bubbles type ना. That frothing from mouth. These are the common symptoms that we find in a poisonous patients. Okay, next, abdominal pain or cramp. So obviously when you are like when you are taking in of some toxic substances, there will be obviously pains in your abdomen, na? Abdominal pains या फिर abdominal cramp होगा. And the other one is redness, skin rash. अगर स्किन का ऊपर में वो chemical flash हुआ या फिर sweat हुआ तो क्या होगा? There will be rashes in the skin, there will be redness, all these symptoms you will see. Can you understand? From whatever roots of poisoning we have explained, from there everything came out, the symptoms. So are you clear?
Yes, ma'am. Yes, ma'am.
Okay,
Yes,
next,
ma'am.
itching भी होगा. Itching is very much common. Okay, obviously skin में अगर कुछ split flash ऐसा कुछ हुआ, okay, तो if for any substance या फिर if अगर toxic plant भी swallow किया तो it can also cause itching also. तो ये सब बहुत common है. And next is swelling. Swelling is also another common symptoms. Swelling, because if there is some like again अगर skin में कुछ problem हुआ तो swelling can also occurs. And then blur visions, तो obviously unconscious होता है ना, like कोई तो like coma में चला जाता है ना. Coma means like prolonged state of unconsciousness when someone is in that condition. So उसका जो visions है ना वो सब ज्यादा पॉइजन ओवरडोज कुछ भी लेने से विजन में भी प्रॉब्लम होता है, देखने में प्रॉब्लम होता है, ब्लर विजन. और सम पीपल तो दे इवन यूज्ड टू हैव डिप्लोपिया. व्हाट इज डिप्लोपिया? Diplopia. Carly is looking to Jiban, but Jiban is only one person, but Carly to like दो Jiban उसको दिखाई दे रहा है. That is called as diplopia. Did you understand, all of you? उसको दो Carly को दो इमेज दिखाई दे रहा है, two image. एक ही इमेज है लेकिन दो इमेज दिखाई दे रहा है. Understand?
Yes,
Ma'am, what
ma'am.
was the term?
Yes, ma'am.
Those are we call like diplopia. That is not common, but blur vision भी होने का chances है, तो diplopia भी होने का chances होता है. Like all those are.
Ma'am, what is the spelling, ma'am?
Okay, DIPLOPIA. Diplopia. DIPLOPIA.
Thank you, ma'am.
You just write a person used to see two images of a single object. You can write like down like that. A person
Double
see,
vision, ma'am.
yeah, a person see two images of a single object. Okay. Okay, next. Irregular, slow or fast heartbeat. तो heartbeat में भी problem होगा. Heartbeat irregular भी हो सकता है और heartbeat बहुत slow भी हो सकता है, बहुत fast भी हो सकता है. हाँ, और अगर heartbeat में problem है तो it relates to our pulse. तो pulse भी irregular हो सकता है, pulse flow slow हो सकता है, fast हो सकता है. So all these are the conditions that is seen in a poisonous patients. Okay, moving on to the next, hyperactivity or slowness. तो कोई जो poisonous patient है ना, काम करने में या फिर कुछ movement करने में बहुत slow होता है. हाँ, और कोई पूरा ज्यादा hyperactive हो जाता है. Hyperactive का मतलब क्या है? What is hyperactive? Hyperactivity का मतलब क्या है?
Means active our body.
हाँ, एक्टिव तो होता है. अभी भी तो तुम एक्टिव हो ना, तो तुम हाइपर
Yes, ma'am.
का मतलब क्या है?
Hyper means ज्यादा means what to say?
Yes, very good.
Exciting.
Yes, okay, Bala, thank you. Hyperactive means like excitement तो सब होता है, लेकिन poisonous patient में कोई लोग ज्यादा ही excitement हो जाता है, ज्यादा ही hyperactive excitement हो जाता है. Do you understand? Did you get the point?
Yes, ma'am.
Or you can
Yes, ma'am.
simply write as extremely active like that, whatever. Okay. Or muscle twitching. So muscle twitching भी होता है. What is muscle twitching? बहुत ज्यादा ही common है muscle twitching. अरे muscle twitching का मतलब क्या है?
Twitching in muscles, ma'am.
twist our
Contractions.
body, man.
Twist our body. Oh, what is the exact meaning? Muscle twitching. Do you know contraction?
Yes, ma'am.
Yes, muscle twitch means like jab muscle contract hota hai. Okay, when there is like contraction, then we call it as muscle twitching. So ये contraction ये सब कब होता है? When जब हम ज़्यादा stress हो जाता है, okay? ज़्यादा stress होता है या फिर when you are when you are taking in too much of caffeine या फिर कुछ वो जो alcohol जो पीने वाला लोग होता है ना जो overdose or over intake whatever it is, taking too much of caffeine, okay, or feel too much of stress, this can also cause muscle twitching, okay. तो ये muscle twitching हो सकता है. तो ये poisonous patient में muscle twitching, that is muscle contraction का sign and symptoms भी दिखाई देता है. Are you clear?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Yes. Okay, seizures. Seizures तो मैंने पहले भी explain कर लिया. Seizure that is
Yes, ma'am.
convulsion, उसको fit भी बोलते हैं. तो पूरा शरीर कांपता है, like all those things. Okay. और seizures का भी अलग-अलग type होता है. So much detail about this is not needed. So you just know the meaning of this. Okay. Next, impaired consciousness or unconsciousness means वो conscious तो हो रहा है लेकिन उसका जो consciousness है ना वो normal नहीं है, वो impaired है. It's not that much conscious, it is impaired. There is a disturb in the consciousness और coma में चला जाने से तो unconsciousness, okay? तो unconscious भी हो जाता है. So these are also the symptoms. So are you clear? These are some of
Yes,
there are
ma'am.
symptoms, but इतना सारा नहीं चाहिए. तो ये सब पूरा जो नॉर्मली जो कॉमन होता है ना ये सब तुम लोगों को जानने के लिए बहुत ज्यादा जरूरत है. तो इसलिए these are the some of the like common symptoms which you will be studying. Okay. Next, slow breathing. तो ब्रीदिंग भी किसी ने बोला था ना तो थोड़ा पहले ब्रीदिंग डिफिकल्टी भी हो सकता है तो स्लो ब्रीदिंग भी हो सकता है. ओके तो और डिफिकल्टी इन ब्रीदिंग भी होता है. डिफिकल्टी इन ब्रीदिंग का दूसरा नाम क्या था मैंने दिया था पहले उसका कुछ 3 वर्ड्स था मैंने जो शॉर्ट करके बोला था. एनीवन कैन टेल मी? Difficulty in breathing medically we are like into this profession na medical profession na so we have to know each and every time क्योंकि hospital में जाने से like बहुत shortcut use करता है like कुछ चीजें बहुत shortcut use करता है. तो difficulty in breathing उसका दूसरा नाम क्या है वो दूसरा words अरे बोलो.
Suffocation.
Ma'am, suffocation.
For subset suffocation. What about others? मैंने 3 वो है एक्रोनियम दिया था किसको पूछूं मैं? जीवन can you please tell me?
Ma'am, shortness of breathing.
Yes, very good. Who is that? Dhritiraj. Very good, very good. With all of you, like those who forgot now, you write it down. SOB, capital letter से लिखना. SOB. S for shortness, O for off, B for breath, shortness of breath. Okay, तो डॉक्टर लोग जब हॉस्पिटल में पेशेंट के हिस्ट्री लिखते हैं ना तो वो लोग डिफिकल्टी इन ब्रीदिंग तो लंबा है ना तो इतना नहीं लिखते पूरा शॉर्टकट से SOB ऐसा लिखता है. तो जब हॉस्पिटल में जब पोस्टिंग होगा ना तब जब when you try to know the history of the patient, when you see the patient this what is that medical report na there at that time when you see SOB, oh this is shortness was सांस लेने में दिक्कत है like that you can identify. Are you clear all of you?
Yes, ma'am.
Yes, ma'am. Yes, ma'am.
Okay, next. Coming to the next is cyanosis. तो किसी ने बोला था ना स्किन कलर भी पेल ब्लूइश होगा तो cyanosis. तो cyanosis ये वाला लिखना. This is very important. Cyanosis. Cyanosis. Have you ever heard before this?
No, ma'am.
You can write down bluish or grayish color of the skin, या फिर nails, या फिर lips, या फिर around the eye. You can just write down bluish or grayish color of the skin. नेल्स भी ब्लू हो सकता है, लिप्स भी ब्लू हो सकता है, हाँ, और ये चोक का आंखें का पास में सराउंडिंग around the eye also it can also be blue color. तो उसको हम मेडिकली वी डोंट राइट इट लाइक दिस, ओके. अगर पेशेंट का अगर हॉस्पिटल में पॉइजनस पेशेंट को देखा उसका स्किन पूरा ब्लू ब्लू है, तो इन हिस्ट्री दे डोंट यूज टू राइट लाइक दिस ब्लूइश स्किन लाइक दिस. मेडिकली सब यूज करता है साइनोसिस. सो यू शुड नो एवरीथिंग. आर यू क्लियर ऑल ऑफ यू?
Yes, ma'am.
Yes,
Yes,
ma'am.
ma'am.
Okay. Next is what to do. अगर poisonous patient हुआ तो हमको क्या करना चाहिए? Okay, now we have studied about it and we have also learned about the different routes of poisoning and we have discussed about the signs and symptoms. हम अभी पढ़ते हैं कि अगर poisonous patient को दिखाई दिया तो हमको क्या करना चाहिए? What we need to do? So safety first and call for help. This is the first point. Safety first and call for help. तो फर्स्ट इज सिक्योर और ओन सेफ्टी. तो ये सबसे पहले ये जाना, क्योंकि पॉइजनस पेशेंट है ना, तो सबको डर लगता है उसका पास में जाने के लिए, लाइक टू गो इन फ्रंट ऑफ द पॉइजनस पेशेंट एज कंपेयर टू द अदर नॉर्मल लाइक अनहेल्दी पेशेंट ना, इट इज वेरी मच लाइक not secure na. So that's why we should always think about our security first and then the safety of the affected person. This is the first and the foremost you need to know. Okay, secure your own safety and then safety of the affected person. Next, the person urgently need help. Shout or call for help if you are alone, but do not leave the person unattended. That means like if the person urgently need help, you have to shout or call for the help. If the ambulance is available, or if you can call for 199 or 108 or whatever it is, you can call for anything. Okay, this is the first thing you need to do. You have to shout or call. Okay, if you are alone, you have to follow this procedure. But remember that never leave the person unattended. Unattended का मतलब है कि अकेला मत छोड़ना, उसका साथ कोई ना कोई रहना है. But do not leave the person unattended. Ask a bystander to call the anti-poison center and to seek help or to arrange for urgent transport to the nearest healthcare facility. ये वाला जो process है हर जगह में same है. तो bystander means उसका जो पास में जो खड़ा होगा ना, we will ask the bystander like to call the anti-poison center. means जो anti-poison center होता है, हाँ, जहाँ पे जो poisonous जो anti-poisonous जो मेडिकेशन रखता है ना, कुछ सेंटर होता है, तो एंटी पॉइजन सेंटर को अगर लाइक इफ यू कुड कॉल, यू शुड कॉल फॉर दैट. एंड ऑल्सो यू शुड ऑल्सो सीक हेल्प for urgent arrangement of the transport facility, okay, to take the poisonous patient into the nearby healthcare facilities. तो उसके लिए वो सब arrange करना है. And tell him to come back to you to confirm if help has been secured. और उसके बाद सब वो ठीक होने के बाद like उसको confirm करना है कि whether he feels secure or not, everything. So this is the first thing that you need to do and you have to call for help. Okay, ये सबसे पहले है, ये yeah, the basic treatment. Are you clear? Yes or no?
Yes, ma'am. Yes,
Okay.
ma'am.
If possible, wash your hand before and after taking care of the patient. Use soap and water to wash your hand. If no soap is available, you can use ash to wash your hands. Alcohol-based sanitizer, ये बहुत common है. To maintain hygiene is very much essential. ना, it not only prevent us from our health, it also prevent us from any kind of like infections, okay, or from any contaminated things. So washing hand is very much important. तो wash hand का जो 7 टेक्निक मैंने उस दिन सिखाया था ना, तो always follow that 7 step in hospital. Okay, then you have to always wash your hand before and after taking of the patient. And अगर soap और पानी available हुआ तो use it, and if it is not available, try to use ash or else आजकल तो sanitizer use करते हैं ना हम लोग, तो sanitizer available हुआ तो try to use this. So these are the basic things. So coming to the next point, use gloves to protect yourself. If gloves are not available, you can use a clean plastic bag. तो क्योंकि condition पता नहीं है ना क्या available है सामने में, तो अगर gloves available है तो gloves जरूर use करना. And gloves are disposable or it is not disposable? Gloves is disposable. Yes. What is the meaning of disposable?
Ma'am, one time use.
What? One time use, right? Okay, very good. One time use. एक बार खोल के use कर लिया तो फेंक देना चाहिए. तो use gloves to protect yourself. अगर gloves available नहीं हुआ तो हमको क्या use करना चाहिए?
Plain plastic bag.
Yes, plastic bag. So as we are a healthcare workers, no, we will be a healthcare workers, so that is why like we should always try to adjust things. Materials adjust करना is our responsibility. ऐसा नहीं है कि कुछ situation में we will always have the first aid bag with us. So sometimes we should try to adjust things by ourselves. So these are the basic points. The safety first and the call for help, the point that we need to know. Are you clear with the 4 points?
Yes, ma'am.
Okay, next. Provide first aid. This is number B. Number A we have completed. This is number B. Provide first aid. So if possible, try to find out what poison has been swallowed, injected, inhaled, or has come into contact with his skin. Okay, but be careful. Do not put yourself in a dangerous situation to find the origin of the poison. The number 5 point है. हमको कैसे first aid provide करना है? If possible, we will try our level best to find out what type of poison has been swallowed. या फिर what type of poison inject हुआ है, या फिर क्या poison inhale हुआ, या फिर क्या poison का साथ उसका skin में contact हुआ. तो ये हमारा first priority होना चाहिए. Okay, so as a healthcare provider or a first aider. Okay, but we should be very, very careful. Okay, we should never try to put ourselves in danger situation. Okay, in order to find the origin of the poison. क्योंकि हम origin of the poisoning को find out करना है. Origin of the poisoning का मतलब है कि ये poisoning कैसे हुआ, swallowing से हुआ, inject हुआ, या फिर कैसे हुआ, ये हम ढूंढने में तो obviously patient का शरीर तो हम check करेंगे ना. We will check the body of the patient. So while assessing the body of the patient, while doing investigation, we ourselves also need to be careful. Are you clear? Yes, sir.
Yes, ma'am.
Yes, ma'am. Yes, ma'am.
Okay, next. If it is safe, keep the container of the poison to the doctor. So जब poison लेने से तो कोई patient तो like after taking the poison they are only into they are like directly into the coma state or into the unconsciousness. So the container or the container, okay, the container of the poison is still in their hand, or it falls down or whatever it is in the nearby surrounding. So that particular container we should keep it nicely, so that when we take the victim to the nearby hospital or wherever it is, we should show the container, so that the doctor will also be it will also be helpful for the doctor, okay, in detecting the type of poison that he or she swallowed. Okay, next. Avoid contact with the poisons. So you yourself also try to avoid contact with the poisons. क्योंकि कुछ इनहेल करने से भी पॉइजनस हो सकता है ना, गैसेस का भी, तो हमको भी बहुत प्रिकॉशन लेना चाहिए खुद को. If not done yet, call the poison center for advice. So अगर कुछ ज्यादा वो हुआ तो, if it is not yet like completely being solved or whatever it is, we have to call the poison center for some kind of advice. तो कुछ एडवाइस लेना चाहिए कि मेरा सामने में पॉइजन है तो लाइक क्या लाइक उससे दूर रहने की, या फिर उससे कितना डिस्टेंस दूर रहना है, और कैसे कंटेनर को रखना है, फुल के ढक के या फिर कहाँ पे रखना है, where to throw, because when you go to hospital now, there are certain kind of dustbin you will find to throw any kind of like waste materials ना, वहाँ पे like वो है BMW बोल के उसका नाम होता है. Do you have any idea where to throw the waste materials and all? BMW? Any idea? Any idea
No, ma'am.
where you taught all these things? You were not taught all these things. Yes or no? Yes or no? Yes or no?
No, ma'am.
ओके एक्चुअली
No,
ना
ma'am.
ऑल दीज आर वेरी वेरी बेसिक थिंग जानना बहुत जरूरत है क्योंकि हॉस्पिटल में एक्सपोज होने से जैसे कि तुमने सिरिंज खोला ओके सिरिंज खोला या फिर कुछ भी मेडिसिन खोला जो प्लास्टिक को फेंकने के लिए अलग सा डस्टबिन होता है एंड ऑल दोस डस्टबिन दे हैव नेम सो इफ यू वांट me to teach you all ना then I will be teaching you all like one day I'll teach you all if you want to know क्योंकि हॉस्पिटल में एक बार जाने से तो ऐसे तैसे नहीं सिरिंज फेंकने का अलग सा डस्टबिन होता है और सबका डस्टबिन का कलर होता है और एवरी हॉस्पिटल इट इज अवेलेबल स्वच्छ भारत सुना स्वच्छ भारत सुना
Yes, ma'am.
Yes,
तो
ma'am.
ऐसे टाइप का ही हॉस्पिटल में भी BMW बोल के वो है हर चीज का फेंकने का तो I think I should teach you all this as a like first aid teacher I think I should yeah बोलो
Ma'am,
बोलो
ma'am. What is the full form of BMW?
what is the full form of
BMW.
BMW that will be your
Yes,
homework
teacher.
There will be your homework, BMW. BMW. There will be your homework. Okay, Balo?
Okay, ma'am.
Okay. Okay, come to the next. The next point is, do not give the person anything to drink or eat. Or do not give milk or water to a poison person. So if you find any person na, like if you find any person drinking or eating means poisonous patient खा रहा है ये सब drink कर रहा है तो you should like advise him to not to have any intake of any substance okay and milk or water तो एकदम नहीं देना है okay do not give milk or water to the poison person these are basic things which you should know okay and do not induce vomiting तो vomiting को induce करने में मना करना है do not induce vomiting so and transport the person urgently to the nearest healthcare facility or hospital which we already discussed so are you clear whatever we have discussed today
Yes, ma'am.
Yes, ma'am.
Yes.
with this like we have completed this about poisoning okay so one of you please tell me what point I have discussed from the root of poisoning anyone
Yes, ma'am.
yeah one of you say yes Samson say root of poisoning
First is poisoning by swallowing.
okay
And second is by poisoning by gases
okay and then
and poisoning by injection and then poisoning by skin absorption.
skin absorption okay okay very good so whatever I have taught you all समझ में आया या मैं ऐसे ही स्पीक कर रही थी या फिर समझ में आया
Yes, ma'am.
Understood, ma'am.
Understood, ma'am.
okay I want you all to know this BMW very like clearly okay so BMW पढ़ के आना means like BMW like उसका बारे में थोड़ा जानने का कोशिश करो अलग अलग सा डस्टबिन होता है और मीन्स पहले में लाइक अलग है और आजकल लाइक अलग देता है मीन्स लाइक वो रिवाइज जो होता है ना रिवाइज का मतलब जो अपडेटेड होता है ना तो वो अपडेट वाला जानने से ही ज्यादा अच्छा है क्योंकि पुराना वाला कुछ दे डोंट फॉलो ना सो द अपडेटेड वन आई विल ट्राई टू लाइक teach you all okay this biomedical waste is very oh my god I already said the meaning okay this BMW the meaning these things is very important to know these things you can write down okay just BMW so that you can remind me is it okay
Yes, ma'am.
Yes, ma'am.
Yes,
Yes,
ma'am.
ma'am.
okay then Jiban done na attendance?
Yes, ma'am.
Okay, do you want the PDF, all of you? If yes, I will send now.
Yes,
Yes,
ma'am.
ma'am.
Yes, ma'am.
Yes, ma'am.
Ma'am.
Okay, then that's all for my today class. Okay, thank you everyone. Have a nice day.
Thank you, ma'am.
Thank you, ma'am.
Thank you, ma'am.
Thank you, ma'am.
Thank you, ma'am.